Good morning, Dr. Ali.
Good morning.
Nice to meet you in Istanbul.
Nice to meet you again. I'm very happy to see you here. Thank you. Welcome. Welcome.
Thank you. Could you tell, please, about your experience, about your background? What are your favorite surgeries?
Especially, I operate for the patients that have very heavy bodies after very much losing weight. Especially, nowadays I work for mummy makeovers. The liposuction, at the same time tummy tuck, at the same time breast lifting and augmentations. Also, my main focus is face surgery. Especially, I like to make face lifts, neck lifts, especially deep face and neck lifts surgeries. And sometimes I see some patients, post-bariatric patients, very sagged skins. So I try to help them to make arm lifts, leg lifts, thigh lifts. These are my main topics. But if you ask about the smaller interventions like blepharoplasties, I do also lower eyelid blepharoplasties and upper eyelid blepharoplasties. And also I make otoplasty. These are my main working fields.
That's great. Could you tell, please, how many years of practice do you have as a plastic surgeon? How many years do you do mummy makeover?
I have a very different survey in this field because at first I started with anatomy residency, and then I became an orthopedics resident. But this was a very small period because my main focus was to make a reconstructive surgery. So I decided to become plastic surgeon, and from 2009 I'm in plastic surgery field. For the last 13 years, it's my own practicing field.
That's great. Can you tell, please, about mummy makeover? What are the techniques that you use for the liposuction, for the abdominoplasty?
Yes.
Maybe you use some innovative techniques, probably.
There are different techniques. For example, for some abdominoplasties, we don't need liposuction if the patient is very slim. But if the patient is a little bit heavy with fatty tissues, we have to make liposuction. For the kind of patients, I prefer using lipomatic device for liposuction. Sometimes patients ask me about some devices with ultrasound,
Like
it is Vaser.
Yeah.
I prefer Vaser for the patients. And sometimes I use J plasma for J plasma to tightening the skin.
Yes.
But in tummy tuck surgery, it is safe to use conventional techniques, as like conventional liposuction with lipomatic. Very little usage of laser, and then conventional abdominoplasty. The abdominoplasty consists of skin. It depends on skin texture. To tighten skin too much or a little bit lax. Yeah. In this technique, I use extended dissection up to all rib arc. I extend there, and I try to exercise as much as possible the skin to have a very tightened abdomen, and also. I settle the incision lines as much as nearby to the vulva. Vulva?
Yes.
To not to be visible.
Seen.
Yes,
Yeah.
not to be visible. And I try to not to extend too much to the lateral sides to create dog ear deformities.
Like to make it as small as possible,
Yes,
right?
yes, actually.
I see. And you told about liposuction with lipomatic.
Yes.
Could you tell more about this?
The lipomatic device is a device that is composed of thrilling effect, of the mechanic effect of taking fatty tissues easier. What does it mean? We use tumescent fluid. At first, we inflate the tissues, we inject tumescent fluid inside to decrease bleeding and to make the liposuction easier. So we use that device. That device is a wavy thrilling effect. What does it mean? While injecting the fluid inside the tissue, it thrills. While thrilling, it
Dissolve.
no, it dissolves the fluid also. Also, the fatty tissue becomes looser with the effect. And then, while making liposuction, again there is a thrilling effect. It is mechanic device, so we don't disrupt the veins, the arteries, the nerves. So if you don't damage the inside tissues, it's easier to heal quickly. That's the device I prefer to use.
What kind of surgeries include makeover? I will explain a bit to our patient that makeover is a surgery after the giving breast to restore the initial form.
Yes.
So what kind of surgery include normally this procedure?
In normally practice, makeover consists of breast and abdomen. What does it mean? After giving birth and breastfeeding, with the effect of gravity and age, the body contour disform. You know, the form is getting looser, getting a little bit. The patient lose the form.
Yeah.
So they ask about getting the older shape. So what we do in this operation, we make a 360 degrees liposuction, back liposuction, thigh liposuction, love handles liposuction to have a curved line as she had before. At the same time, we make a tummy tuck surgery. We excise the excess skin. We take all the skin. At the same time, while giving birth, while pregnancy, the abdomen becomes bigger.
Yeah.
So we have the patients, ladies, have a laxity of the fascia tissues.
Yeah.
So we have to restore,
Yes.
to repair the fascia also. So in this surgery, we tighten that dehiscence of the fascia tissues. So we put stitches, sutures inside between the muscles.
I see.
So we tighten to get a flatter abdomen. So in this operation, tummy tuck operation, I'm talking about the tummy tuck part, we create a new navel,
Yes.
belly
Yes,
button.
yes.
We create a flat abdomen.
Yes.
At the same time, we try to make slimmer and curved body, trunk. So this is first part. The second part. The second part is breast. The ladies has sagging because of the, as again I say,
Yes,
breastfeeding.
breastfeeding.
So sometimes they have all loss of tissue, breast tissue. We restore that tissue with implants. Second, sometimes they don't need any tissue. They don't need any implant. We restore, we give the new shape again to their breast with their own tissues by lifting. Sometimes they have very huge breasts, so we have to reduct to make smaller breasts at the same time lifting. So we have different intervention times, even intervention types for this kind of patients. As a summary, we can make only reduction mammoplasty. We can make lifting with reduction mammoplasty. We can make lifting with implants. We can make only implant.
I
Four
see.
different interventions for the breast.
And is it possible to do vaginoplasty? Sometimes there is also the
yes.
issue.
Also, we make genital surgeries because, as you know, with normal delivering, birth
Yeah.
giving, if it is vaginal birth giving, the vaginal tissues
It's
again
also
they get
loosened.
laxer, so we have to tighten it. We make it in a closer operation. It takes almost 1 hour after the operation. We give some recommendations to the patients for the healing times. Also with the labioplasty, we do labioplasty also for the vulva. We can make fat injections, reduction surgeries for the labium major and minoris.
I see. And how many time the patient should wait after giving birth for the mommy makeover?
Yes, this is very common question because the recovery of time after the birth giving is very important. For the abdomen, for an abdominoplasty, we should wait at least 9 months after the surgery because the muscles, the soft tissues reduct. They come back. But for the breast, the important part is if the patient has breastfeeding after the birth giving, we should wait 1 year.
After she finished the
Yes,
breastfeeding.
yes, she finished the breastfeeding because the tissues, I have some experience about it. I had some inpatient patients. I did surgeries, I had experience about it, but I don't recommend. I recommend that if you stop the breastfeeding, please wait 1 year and then you can come safely to have that surgery.
I see. And how much time the patient should be in Istanbul for this surgery?
For this surgery, we need generally 7 days. First 2 days, they be in the hospital. First day they come to hospital, we have some tests. And after that tests, we take the operation, we make a plan, operation plan. We take this patient to the operation. First night, second night, we follow up the patients with tests, with general status. If everything is okay, we discharge them to the hotel. After discharging, I see the patients, I follow up the patients for 2 or 3 times, sometimes in the hospital, sometimes in the hotel. If we need, I can go to the hotel for the check, the patient. We need 5 days after surgery. And in this period, we want patients to have some special garments, some special exercises, some special foods. We advise them.
And you also put some compressive clothes?
Yes.
And for how long?
That compressive garments, we say corsets for them, we recommend them to use for 2 months because they help the tissues to heal quickly, and also lymphatic massage. The lymphatic massage is a very, very effective tool for improvement after the surgery.
It is also can be provided in Istanbul while they are in this.
Yes, actually, yes.
And they should continue for how long when they come back home?
It depends on the patient's general status. Sometimes the patient has 8 sessions, sometimes the patient has 20 sessions. It depends on healing response of the patient's body. But 10 sessions is average.
And for example, if the patient wants to have another baby, another pregnancy,
Yes.
when it can be possible, and is there any restrictions for this?
Yeah. I read a paper. Nowadays, I read a paper about it. We use PDS sutures. PDS sutures are absorbable sutures, you know, so they absorbed.
Yeah.
We recommend 2 years. After surgery, a 2-year period for a new pregnancy. They can have a very safe pregnancy after 2 years, no better.
And what recommendations do you give to your patients after the surgery?
After the surgery, we want them to, especially just after surgery, I want them to drink water, too much water, because the blood, also the body, lose very, very much water after surgery. So we have to restore it. We want them to drink water. We want them to move. The movement also enhances lymphatic circulation. So it improves healing time, very shortens healing time. The third, we want them to have feeding frequent, but small portions. What does it mean? We want them to take protein and vegetables. Vegetables for bowels, protein for restoring. Because after in healing process, in inflammation time, they need protein.
Yes.
For what? How can I express it? It's a stone, like
for construction of
yes,
the new muscles.
Yes. And again, I mentioned that to make massage, the main part is sports. The patients always ask me about the sports. We recommend them to start very, very light sports after 1 month, like walking, triggers. But after 2 months, they can start every sport. They can do everything. For the first month, why we don't want to make them heavy sports? Because we have stitches.
Yes.
So they may harm the patient's body. These are my main advice, main recommendations after surgery.
And do you have some advices or some recommendations how to do the surgery more efficient? Maybe to lose some weight before the surgery, or to have some diet, or
Yeah.
to drink water or something else?
Very, very important point. Thank you. The body mass index, we calculated. The
Yes.
body mass index should be lower than 30 if you want to get a very effective result. Because heavier patient needs more fat, more fatty tissue. More fatty tissue means that we have to take more fat.
Yes.
But more fatty tissue also makes us trouble about the surgical safety. So we want patients to have a very strict behaviors about eating before the surgery, to have a tightening
For
process.
how long
For how long?
before
If
the
they-
surgery they
yes.
should start preparing?
If they get the body mass index after under 30, if they can maintain this for 3 or 4 months, it means that they are ready for the operation.
I see.
Is it clear?
Yeah.
Yes.
Okay, and besides the diet, what else? And the sport that they should do to reduce the
Healing.
body index?
Healing
Yeah.
process.
I mean, to prepare for the surgery efficiently.
To prepare the surgery for efficiently, the main problem for us is bleeding after
Bleeding, yeah.
yes, while the surgery. So we want them to seize vitamins, to stop vitamins before the surgery. At
Which
least
vitamin?
15 days. Vitamin E, vitamin C. These are very bleeding vitamins. Ginger. If they have intrauterine device, intrauterine device
Yes,
for
yes.
contraception, if it is only copper, no problem. But if it contains
Hormone.
hormones, it is a very, very big problem for us for clotting, for embolia,
Yeah, I know.
thromboembolic
When-
events.
yes.
And also, if they have some green tea or some herbals, if they take some herbals, please, I want patients to stop them before the surgery almost 1 month. Because the effect is long term. So the effect will stop before the surgery. And to stop the pills, hormone pills.
Contraceptive.
Yes, please. It's very important because it's a very, very big problem for us. We have some, experience about these kind of patients in texts we read, we see. So we warn the patients about these kinds of topics.
I see. And how many maximum lipid you can take with the liposuction?
Yes, in generally, in textbooks, it is recommended to take 5% of the total body weight. What does it mean? For example, if the patient is 100 kilograms, we can take 5 kilograms. But sometimes we extend it. 6 kilograms, 8 kilograms, until we can reach that, we can extend the range.
Yeah.
So it depends on the patient's body. We try to take the amount that we can achieve this ideal body shape. We discuss it with the patient how much we will take. But the main, the general command for this kind of surgeries to take 5%.
I see. Thank you very much, Dr.
You're
Ali. It
welcome.
was very interesting to speak to you.
It's very nice to meet you, to see you in Istanbul. I wait all the patients, I wait our guests to see you here. Okay?
Yes, thank you very much.
Thank you. Bye.